Good morning. Today let us study about the facial nerve. Facial nerve can be discussed under following headings: the introduction, nucleus and functional component, cores and branches, areas applied and applied aspects. Coming to introduction, the facial nerve is the seventh cranial nerve. So the facial nerve will be starting from the pontomedullary junction, Okay, it has got both the motor component and the sensory component. So it has got both the motor component and the sensory component. Okay. Facial nerve supplies the muscles of facial expression and some of the muscles of the neck, and also it carries taste sensation of the anterior two-thirds of the tongue, and also it supplies some of the glands, that is the submandibular, sublingual, and also some of the glands which are present in the nose and the palate. Okay, this is about the introduction to the facial nerve. Now we'll study about the nucleus which are present in the facial nerve. So the main motor nucleus of the facial nerve is located in the lower part of the pons. This is the pons as the main motor nucleus of the facial nerve. Next, the sensory nucleus, mainly the nucleus tractus solitarius. The nucleus tractus solitarius is present along the along the upper part of the medulla. Okay, it is present along the medulla. Then we have one more nucleus which is related to the facial nerve, that is the superior salivatory nucleus. This is the superior salivatory nucleus. Okay, along with the superior salivatory nucleus, we have one more nucleus which is closely related to it. It is called the lacrimatory nucleus. Okay, which is almost related very close to the superior salivatory nucleus, that is the lacrimatory nucleus. Okay, and there is one more nucleus which contributes in the formation of a small part of the nerve supply, that is the spinal nucleus of the trigeminal nerve. Okay, the spinal nucleus of trigeminal nerve, which will be located in the medulla. This is the spinal nucleus of trigeminal nerve. Mark all these things. So these are the nucleus which are related to the facial nerve. Now, if you come to the motor nucleus, this is the nucleus which is going to control the muscles of facial expression mainly. Okay, that is muscles of facial expression. Then if you see the lacrimatory nucleus, it is responsible for the tear production. So it is going to supply the lacrimal gland. Okay. Now superior salivatory nucleus. So superior salivatory nucleus, as the name implies, it is going to supply the salivary gland. Okay, it is going to carry the secretomotor fibers to the salivary glands. Next, the nucleus of tractus solitarius is responsible for taste. It is responsible for taste of the anterior two-thirds. Then the spinal nucleus of the trigeminal nerve will be giving some fibers which will supply the sensory component of a part of the ear. Part of the external ear. Little bit of the external ear is supplied by the sensory fibers which are coming from spinal nucleus of trigeminal nerve. Now, since the motor nucleus is going to supply the muscles derived from the second branchial arch, these fibers, here the motor fibers which are arising from the motor nucleus will wind around this nucleus. This is actually the abducens nucleus. Will wind around the abducens nucleus and it will form a small elevation into the floor of the fourth ventricle, and this elevation is called the facial colliculus. This elevation is called facial colliculus. Already we have discussed about the facial colliculus in the section of pons. And then the nerve will emerge anteriorly. Okay, and then they emerge anteriorly. These fibers are called special. So it is special because it is developed, it is going to supply the muscle derived from branchial arch, second branchial, mesoderm of the second branchial arch. Okay, so it is called special visceral. Okay, so it's called special visceral. Since the fibers are going away, it is efferent, special visceral efferent. So motor, so it is efferent. Okay, so it is having special visceral efferent component, which is the main motor nucleus of facial nerve. The second component is this one, the tractus solitarius. the tractus solitarius, or you can call it a solitary tract nucleus. This solitary tract nucleus is going to carry the taste sensation. So it is concerned with special sensation. Okay, so it is a special sensation. So it is called special visceral. Okay, and it is afferent fibers. All the fibers are coming towards. Okay, so it is afferent fibers. So the fibers are here. Okay, these are the fibers of tractus solitarius. They are all special visceral afferent fibers. Next, the fibers which are coming to the superior salivatory nucleus. Okay, these fibers are going to supply the glands of the palate, nose, submandibular gland and the sublingual gland. So these fibers are going to, these fibers which are coming from the superior salivatory superior salivatory nucleus will be considered general sensation, general visceral efferent, okay, general visceral efferent. Okay, it is going to control the production of saliva, it is going to control the production of mucus which is coming from the palatine glands and also from the nasal mucosa. Okay. Next is this lacrimatory nucleus. This lacrimatory nucleus is responsible for the production of tear. So this is also considered as general visceral efferent. So these are supposed to be supplying the viscera. So it is general visceral efferent fibers. Okay. Then the last one is the spinal nucleus of the trigeminal nerve. From here, whatever fibers are coming is going to carry the general sensation of the external ear, a small part of the external ear, and hence it is called as general somatic afferent fibers. Okay, general somatic afferent fibers. Now we can see we have special visceral efferent fibers which will be coming from the motor nucleus. We have general visceral efferent component which will be coming from superior salivatory and the lacrimatory nucleus. Then we have the fibers which are coming from the solitary tract which will be carrying the somatic visceral afferent fibers. At last is the general somatic afferent fibers which will be coming to the spinal nucleus of trigeminal nerve. So these nerves together are the sensory component and this is actually the motor component. So the motor component will be present on the medial aspect and the sensory on the lateral aspect. Okay. This sensory component is found to emerge between the motor component and the vestibulocochlear nerve. Hence, it can be otherwise called as nervus intermedius. This thing can be otherwise called as nervus intermedius. Okay, nervus intermedius. Okay. Next, we'll study about the cores and branches. After it emerges out of the pontomedullary junction, it travels to a short distance intracranially to enter inside this foramen. Okay, this foramen here, the internal acoustic meatus, to enter inside foramen called the internal acoustic meatus. So this is the internal acoustic. So he enters inside the internal acoustic meatus to travel inside the petrous part of the temporal bone. Okay. Now, after the nerve is entered here, just we will break this area so that we can study the cores using a diagram. Okay, so once we break that area here, okay, the nerve will be passing anteriorly. Okay, the nerve will be passing anteriorly, anterolaterally. Okay, it will be passing anterolaterally, and once it reaches here, it will be present on the suprolateral border. Okay, suprolateral border, or we can on antero-superior border. It is present on the antero-superior border of the medial wall of the middle ear. Just consider this as the medial wall of the middle ear. As we are drawing the middle ear, this is the medial wall of the middle ear. So imagine this is the medial wall of the middle ear. Okay, so this side will be the lateral wall of the middle ear, here will be the anterior wall of the middle ear, posterior wall will remove. Okay, now you can see this is the medial wall of the middle ear, and this nerve which is emerging from here will travel, then take a turn posteriorly, and it will be found in a canal. It will be related to the superior aspect of the medial wall of the middle ear. Then it takes a turn down and it comes down, and this canal is called the facial canal. This canal is called the facial canal, which is located in the medial wall of the middle ear. And this facial canal will end inferiorly, and it opens out of the cranial cavity via a foramen, which is present at the inferior base of the skull. This foramen is called the stylomastoid foramen, and this foramen is called the stylomastoid foramen. The nerve is coming from it is entering the internal acoustic meatus. This is the internal acoustic meatus. So it is traveling inside the substance of inside a canal which is present in the petrous part of the temporal bone. It is taking a turn when it reaches the anterosuperior angle of the medial wall of the medial wall of the middle ear. So this is the medial wall of the middle ear, anterosuperior aspect of the medial wall of the middle ear. Here it presents a bulged portion of the nerve. This bulged portion at the turn, exactly at the turn, is called the geniculate ganglia. Geniculate ganglia. Okay, and then the nerve turns backwards along the superior border or the superior aspect of the medial wall of the middle ear, superior aspect of the medial wall of the middle ear, in a bony canal which is present in the medial wall of the middle ear. Okay, then once it reaches the posterior most end, it descends downwards. It descends downwards. Okay, to emerge out through the stylomastoid foramen. This is the stylomastoid foramen. Stylomastoid foramen. Okay. If you see the base of the skull, this is the mastoid process. This is the mastoid process, and this is actually the styloid process. This is the styloid process. Between that, we have a small foramen here. This is the stylomastoid foramen, through which only the extracranial course of the extracranial part of the facial nerve will be entering through this foramen. Will be leaving the cranial fossa through this foramen. Okay. Now we'll draw the rest of the walls of the middle ear. So this is actually the lateral wall which I am drawing here, the lateral wall of the middle ear. Lateral wall of the middle ear. This is the tympanic membrane. This is the tympanic membrane, and here we'll have one important bone. This is the malleus. Okay, this is the malleus. The handle is attached to the tympanic membrane. It's the malleus. Okay, so just the incus is attached here. This is the incus. It's the incus. Next, we will draw one more wall of the middle ear. This is the anterior wall. So this area is the anterior wall. This is the medial wall. This is the lateral wall. So we have removed the posterior wall and the roof. Now you can understand this is the medial wall. Through the superior aspect of the medial wall, the nerve will be passing posteriorly. Once it reaches the postero-superior angle, it descends down. So the entire course of the nerve in the medial wall of the middle ear is present inside a canal, bony canal. Okay, bony canal. Then it enters out through the stylomastoid foramen to emerge out. Okay, of the cranial cavity. So here in the medial wall, it is related between the lateral prominence of the lateral semicircular canal superiorly and inferiorly it is related to the promontory, and this is actually the lateral semicircular canal. Okay, prominence of the lateral semicircular canal. So it is present superior to the promontory and inferior to the lateral semicircular canal, this horizontal part. And this canal through which the facial nerve is passing is called the facial canal. Okay, this is called the facial canal. Next, we'll study about the branches given off at different levels. First, if you consider the branch which is coming from the geniculate ganglia, the branch is called as the greater petrosal nerve. It's called the greater petrosal nerve. The greater petrosal nerve emerges from the geniculate ganglia, then it will pass anteromedially. Okay, then it will pass anteromedially inside the content of the petrous part of the temporal bone, in the small canal which is present inside the petrous part of the temporal bone, then emerges out from the petrous part of the temporal bone through a canal. Okay, this canal is called aperture for the greater petrosal nerve. This is the canal for, or the opening of greater petrosal nerve. Okay, we can see the opening here in the skull. You can see here, this is the opening of the greater petrosal nerve. This is the opening of greater petrosal. Then it travels anteriorly, anteromedially to reach up to the foramen lacerum. You can see there is a small groove which is related there up to the foramen lacerum. Here it is related posterior to the geniculate, posterior to the trigeminal ganglia. The trigeminal ganglia will be located in this trigeminal cave. Okay, will be located in this trigeminal cave, and this nerve will be passing through this groove, and this nerve will be related posterior to the trigeminal ganglia. Okay, the greater petrosal nerve will be related posterior to the trigeminal ganglia. Then it will emerge out to relate to the foramen lacerum. Okay. Then it passes along the groove for the greater petrosal nerve. Then it is related posterior to the ganglia, the trigeminal ganglia. Here it is joined by a nerve which is coming from, it is joined by deep petrosal nerve. This is actually the internal carotid artery which will be there in the cranial fossa, and the plexus will be found around the internal carotid artery. From there, the deep petrosal nerve. This is the deep petrosal nerve. So it will be joined by the deep petrosal nerve to enter inside the foramen lacerum. So here will be the foramen lacerum. This is the foramen lacerum. This is the position of the trigeminal ganglia. Okay, the nerve is passing posterior to the trigeminal ganglia, entering into the foramen lacerum. Okay, by joining with the deep petrosal nerve. So now this yellow color represents the petrous part of the temporal bone. Okay. Okay. Now, after joining with the deep petrosal nerve, after the greater petrosal nerve joins with the deep petrosal nerve, it will become the nerve of the pterygoid canal, which will be passing anteriorly. So this is actually the nerve of the pterygoid canal. This nerve of pterygoid canal will join with one important ganglia which is in the pterygopalatine fossa, that is the pterygopalatine ganglia, which will be joining with the pterygopalatine ganglia. Already we have studied about the pterygopalatine ganglia in relation with the maxillary nerve. Okay, we can see here is a maxillary nerve. So this nerve will be entering here through an opening here. Okay, that is the canal. Okay, that is the canal which is here. Okay, the nerve of the pterygoid canal. That is the pterygoid canal through which it will be communicating with that of the pterygopalatine ganglia. From the pterygopalatine ganglia, the secretomotor fibers will pass through these two nerves. That is the greater palatine nerve and the lesser palatine nerve. So this is the greater palatine nerve and the lesser palatine nerve. It will emerge out through the greater palatine foramen and the lesser palatine foramen to supply the glands which are present in the soft palate, and also it will be supplying the glands which are present in the hard palate. Okay, so this is how the secretomotor fibers are going from the facial nerve, and it will be traveling via the nerves which are related to the maxillary nerve, okay, through the ganglia, pterygopalatine ganglia. Okay, next it also supplies the nasal mucosa through and also the lacrimal gland. How? We can see these fibers also re-enter into the maxillary nerve, then into the zygomatic branch, inferior or through the inferior orbital fissure, it will enter inside the zygomatic branch. Okay, so this is the zygomatico-temporal nerve and this is the zygomatico-facial nerve. So the nerve will go via the zygomatico-temporal branch to reach a communicating branch to the lacrimal nerve. You can see that it is communicating to the lacrimal nerve. Once it has communicated to the lacrimal nerve, now we can see in the ophthalmic nerve, see we can see there is a lacrimal branch. There is a lacrimal branch. So this zygomatico-temporal nerve which we saw here from the maxillary nerve is joined to the lacrimal nerve. So this is a communicating branch. Joined to the, so the nerve fibers which are carrying the secretomotor fibers to the lacrimal gland is coming through this communicating branch. Then it will re-enter inside the lacrimal nerve to supply the lacrimal gland. So this is how the lacrimal gland is receiving its secretomotor fibers. Okay, this is how the facial nerve is supplying the secretomotor fibers to the lacrimal nerve via the trigeminal nerve. So this is the pterygopalatine ganglia. From there it is going to supply the glands of soft palate and hard palate and also the nasal glands and also the nose glands. Okay, and it is also carrying the fibers to the lacrimal gland. Okay, so it is also involved in the carrying the secretomotor fibers to lacrimal gland. Okay, this is about the greater petrosal nerve. Okay, this is about the greater petrosal nerve. We'll study about the second branch. Next, let's study about the branches which are emerging inside the middle ear. Inside the middle ear. If you see, this is the facial canal. In the descending part of the facial canal, a small motor branch will be emerging to supply the stapedius. It will be supplying the stapedius muscle. Okay, so this is the first branch which is inside the middle ear. It will be going into the small canal which is having the stapedius muscle and it will be supplying the stapedius. The next branch will be emerging almost 6 millimeter above the stylomastid foramen. If you see, this is the stylomastid foramen, 6 millimeter above the stylomastid foramen. This nerve is given off. This is actually the chorda tympani branch. We can see it is coming from mainly the solitary tract nucleus. These fibers through the genicular ganglia. So this is actually the chorda tympani. This chorda tympani leaves the medial wall by the posterior canaliculus, and this canaliculus is posterior canaliculus. Okay, and this branch is the chorda tympani. Okay, after leaving through the posterior canaliculus, it will traverse the middle ear to enter into the substance of the tympanic membrane on its posterior border. This is the posterior border of the tympanic membrane. So it will enter deep to the mucosa of the posterior border. Then it will enter and that will be present between the tympanic membrane and the handle of the malleus. Okay, it will be passing deep to the mucosa. It will be present between the handle of the malleus and the tympanic membrane. Then it will emerge in the anterior border, from the anterior border of the tympanic membrane to enter inside a canaliculi which will be present in the anterior wall of the middle ear. This is the anterior wall of the middle ear, so you can consider. So this is the anterior wall of the middle ear. So it will enter through the canaliculi which is present in the anterior wall of the middle ear to come out. Okay, and this canaliculi is called the anterior canaliculus. After emerging out of the anterior canaliculus, the nerve will come out of the cranial cavity through this fissure, the petrotympanic fissure. This fissure is the petrotympanic fissure. So the nerve will be emerging out through the petrotympanic fissure. So the fissure here is called petrotympanic fissure. Petrotympanic fissure. Then this chorda tympani, after traveling a short distance, it will join with the lingual nerve. It will join with the lingual nerve. So this is a lingual nerve. Okay, it will travel via the lingual nerve to relay in the submandibular ganglia. To relay in the submandibular ganglia. So this is the lingual nerve. So to relay in the submandibular ganglia, from there the fibers will come out of the submandibular ganglia to supply the submandibular gland. Okay, it will supply the submandibular gland. So it is carrying the secretomotor fibers to the submandibular gland. Then few fibers will travel back along the lingual nerve to supply the sublingual gland. To supply the sublingual gland. The ganglia. This is the ganglia. This is submandibular gland. This is a sublingual gland. Okay. And the termination of this chorda tympani supplies the anterior two-thirds of the tongue. So it will be supplying the anterior two-thirds of the tongue. So it is carrying the taste of anterior two-thirds of the tongue. Okay, it is carrying the taste of the anterior two-thirds of the tongue. So this the taste sensation is carried via the tractus solitarius. So tractus solitarius is responsible for the taste. The nerves which are supplying the submandibular and the sublingual gland are actually coming from the superior salivatory nucleus. You can follow this blue color. So the superior salivatory nucleus, the fibers are coming through the nerve. It's actually superior salivatory nucleus fibers which are actually supplying the submandibular and the sublingual. Okay. So these are the branches which are given off inside the middle ear, from inside the middle ear. Okay. Next we will study about the branches which are given off after it passes out of the stylomastoid foramen. Here the stylomastoid foramen, anteriorly it is related to the styloid process. Posteriorly, it is related to the mastoid process. Okay, this is a mastoid, this styloid process. Okay, this is a styloid process. Now, the nerve which is emerging out will cross the styloid process and it will cross a vein which is a retromandibular vein. So, this is crossing the retromandibular vein. And it will be crossing one artery, that is the external carotid artery, crossing the external carotid artery. So this is the external carotid. Okay, so the nerve is crossing all these things and it is found deep inside the substance of this gland, the parotid gland. Substance of, so this is a parotid gland. So the nerve is passing deep inside the substance of the parotid gland, and inside the substance of the parotid gland it divides into multiple branches. You can draw parotid duct here. This is a parotid duct. Multiple branches. So, and that branches will be emerging out through the anteromedial surface of the parotid gland, and we can see it from the anterior border. The first branch is a temporal branch. Next is a zygomatic branch, is temporal, is a zygomatic. Then we have a buccal branch. So two in numbers usually. This is upper and this is lower buccal. Okay, lower buccal. These two are buccal branches. Buccal branch. Then we have one branch which runs along the margins of the mandible. So it is called marginal mandibular. Marginal mandibular. Then at last, a cervical branch which will be going towards the neck. This is the cervical branch. Okay, these 5 branches which is emerging out of the anterior border of the parotid gland will be supplying the muscles of the facial expression. Like the temporal branch will be mainly supplying the muscles around the muscles in the temporal region, mainly the frontal belly of the occipitofrontalis, and the cervical branch will be supplying the platysma. Like that, all the branches, the zygomatic branch, the buccal branch, and the marginal mandibular branch will be supplying the respective facial muscles in the face. Okay, all will be supplying the facial expression muscles. So it is all motor fibers. Okay, all these are motor, and since it is supplying the muscles derived from second branchial arch, it is called special visceral. Okay, special visceral efferent fibers. Special visceral efferent fibers. Okay. So before the termination, it also gives a branch called the occipital branch. It is the occipital branch which will be supplying the occipital belly of occipitofrontalis. Occipital belly of occipitofrontalis. And one branch will supply the parts of one branch will be supplying the muscles of the ear. Okay, muscles which are related to the ear. So this occipital branch will supply the occipital belly of occipitofrontalis and also the muscles of external ear. Okay, muscles around the ear. Okay, muscles around the ear. Okay, next there will be one more branch. There are 2 more branches which are motor. Again, it will be supplying the posterior belly of digastric and stylohyoid muscle. Stylohyoid muscle. Okay, these are the terminal branches after it comes out of the cranial cavity. So once more we'll tell, after it comes out of the cranial cavity, it descends down, it crosses the styloid process and also the retromandibular vein and the external carotid artery, and it is found inside the substance of the parotid gland. Inside the substance of the parotid gland, it gives of 5 branches: the temporal, zygomatic, upper and lower buccal, marginal mandibular and the cervical. So together it will be supplying the muscles of facial expression. Similarly, there is one branch which goes behind the mastoid process, and that is called the occipital branch, which will be supplying the occipitofrontalis muscle and the muscles around the ear. Then we have 2 more branches which will be supplying, one will be supplying the posterior belly of digastric and other one will be supplying the stylohyoid muscle. Now we'll summarize all the branches once more. From the geniculate ganglia, we have the greater petrosal nerve. Okay. Then from the middle ear, from inside the middle ear, it gives a branch to the stapedius, and it gives a branch called the chorda tympani. Okay, which will be supplying the submandibular sublingual gland, and also it will carry the taste sensation to the anterior, carries the taste sensation from the anterior 2/3 of the tongue. Okay. Next, after coming out of the stylomastoid foramen, it gives terminal branches for the muscles of the facial expression and also to the occipital belly of occipitofrontalis. Okay, this is about the branches of the facial nerve. The last branch which we didn't explain so far is the spinal nucleus of the trigeminal nerve, general somatic afferent. These fibers actually, it will be joining with the vagus. It will be joining with the vagus, and through vagus it will be supplying a small twig to the external ear, skin around the external ear. Okay, so these are all the branches. Next we'll study about the applied importance. In any injury or any disease which is related to the middle ear, okay, any disease which is related to the middle ear, there is otitis media, it can cause erosion of the nerve, which will cause damage to the nerve, that is a facial nerve which is running through the middle ear. Okay, when there is a damage to the facial nerve, it can cause altered taste sensorium. Okay, because the taste is carried via the chorda tympani, which is going through the middle ear. Okay, so there can be altered taste sensorium, and since this nerve is injured here, it can cause motor deficit. Okay, the muscles of facial expression can get paralyzed, and this condition is called Bell's palsy. Okay, this condition is called Bell's palsy, otherwise called as lower motor neuron type of facial palsy. So the facial nerve, the most common place where it can get compressed or it can get damaged is the middle ear, and if it happens in the middle ear, it will cause Bell's palsy. Now we'll explain the Bell's palsy. There are explain Bell's palsy, and also we'll compare with upper motor neuron facial palsy. So you can represent this is the cerebral cortex. This is cerebral cortex. This is the facial nerve nucleus. The facial nerve nucleus, and we can draw the face here. Just a illustrative diagram to represent the face. This is the upper half of the face, and this is the right side of the face. This is the right side of the face, and this is the left side of the face. Is the upper half and the lower half. Okay, and the nucleus also can be divided into upper part and the lower part. Upper part and lower part. Upper part and lower part. Okay. For understanding the facial palsy, Bell's palsy and the upper motor neuron facial palsy, we need to know about the connections. Usually the cerebral cortex will be controlling the opposite side facial nucleus. Okay, this is controlling the opposite side facial nucleus. Okay, control. But the facial nerve, the upper part of the facial nerve nucleus also is controlled by the same side also. Okay, the same side cortex also controls the upper part of the facial nucleus. Similarly, it happens to the other side also. Usually the opposite side cortex will be entirely controlling the facial nucleus, but the upper part of the facial nucleus also receives fibers which are controlling the nucleus from the cortex. Okay, so upper part of the facial nucleus has got bilateral representation in the cortex. Next, what we have to understand is the upper part of the facial nucleus controls the upper part of the face, and the lower part of the facial nucleus controls the lower part of the face. It happens on either side like that. Okay, the upper part of the facial nucleus controls the upper part of the face, and the lower part of the facial nucleus controls the lower part of the face. Imagine in case of Bell's palsy, that means the nerve is getting damaged. So this is the nerve. This is the nerve. The nerve is getting damaged in the middle cranial fossa, inside the middle ear. Most common place is inside the middle ear. If it is getting compressed here, the nerve is compressed, it will result in Bell's palsy. That means the whole upper part and the lower part of the face on one side is, both upper part and the lower part of the face on one side is paralyzed, on the same side is paralyzed. Okay, that is lower motor neuron facial palsy, or the Bell's palsy. Okay, similarly, now we'll just compare it with the upper motor neuron facial palsy. If the lesion happens at the cerebral cortex level, okay, we'll just consider the cerebral cortex level. Okay, so lesion is happening somewhere in the cerebral cortex or in the pathway. fibers, wherever it is coming from. Okay, so if this is happening, just you can see these fibers are going to control opposite side facial nucleus. So we can imagine the opposite side facial nucleus will be paralyzed, but the upper part of the nucleus is still controlled by the opposite side, the same side cerebral hemisphere. Okay, same side cerebral cortex. So same side fibers. So what is happening is here the upper part of the face is spared. Here the upper part of the face is spared. Only the lower part will be damaged. Only the lower part there is lesion. Okay, only there is the lower part of the facial muscles are paralyzed. So the patient can close the eyes and the wrinkling on the affected side, and the wrinkling of the forehead will be preserved on the affected side. Okay, that is the difference between upper and lower motor neuron facial palsy. So in upper motor neuron facial palsy, the upper part of the face is spared, only the lower part gets affected. Okay, thank you.